is Dr. Mohammed Hasan NAZ. Is Dr. Nurnika here? Okay, so you will be next.
Good evening, everyone. My topic of discussion is morphological analysis of lacrimal punctum using anterior segment optical coherence tomography in different age groups. Coming to the introduction, lacrimal puncta are the small opening located at the inner corners of the upper and lower eyelids, responsible for drainage of tears from the ocular surface. The size and shape of lacrimal punctum can vary with age, impacting tear drainage and potentially leading to conditions like punctal stenosis. Knowledge of the lacrimal punctum anatomy is essential in diagnosing and managing various ocular surface disorders and surgical interventions. My aim of study is to evaluate lacrimal punctum changes across different age groups using AIOS2025 and to identify how age and gender impact punctal parameters such as external punctum diameter, internal punctum diameter, and vertical canalicular depth. The materials and method. My outcome measures were external punctum diameter, internal punctum diameter, vertical canalicular depth, fluid seen within the punctum, and presence of ampulla. Inclusion criteria was healthy subjects aged between 20 to 80 years, and exclusion criteria was the patient underwent any lacrimal surgery, patient with canalicular tear, post-DCR DCT patient, patient with congenital punctal anomalies, and the patient using anti-glaucoma medications. And we divided the study in 4 groups. The age groups were 21 to 35, 36 to 50, and 51 to 65, and 66 to 80, and each group contained 32 eyes. For this, we use a cotton bud, which was gently positioned below the punctum and rolled to invert the punctum into a plane perpendicular to the light source while the eyes were open. A single scan was obtained using the anatomical automated real-time system, and OCT pictures were taken for the area surrounding each punctum after the long axis of scan acquisition was rotated to roughly parallel to the lead edge. Coming to the results, the external punctum diameter, the mean EPD varies significantly across age groups, with the highest measurement observed in the 36 to 50 years age group, that is 622 micrometer, and the lowest in the 21 to 35 years of age group, that is 511 micrometer. And internal punctum diameter also shows notable variation, peaking at 303 micrometer in the 36 to 50 years of age group, while the lowest value of 252 micrometer is recorded in the 51 to 65 years of age group. And vertical canalicular depth measurement range from 874 micrometer in the 21 to 35 age groups to 448 micrometer in the 66 to 80 years of age group, indicating a substantial decrease with age. This is the comparison of lacrimal parameters between male and females, and we can see almost all the parameters were in lower side in female compared to male. Coming to the discussion, demographic characteristics, we studied 128 eyes from 64 healthy subjects, and we divided into 4 age groups. Discussion of findings. The study reveals significant age-related changes in lacrimal punctal dimensions, suggesting that normal variations exist as patients' ages. And understanding these variations can aid in the diagnosis of punctal stenosis, distinguishing between physiological and pathological conditions. And the findings align with previous studies, indicating that punctal parameters differ across genders, reinforcing the need for gender-specific assessment. The previous studies shows that done by Timlin et al., the mean EPD was 646 micrometer. By Kamal et al., the mean EPD was 214, and mean VCD was 890 micrometer. And in our Persian study, the mean external punctal diameter maximum was 622 micrometer, and mean vertical canalicular depth maximum it was 874 micrometer. Age-related findings. External punctum diameter increases from ages 21 to 50 and peaking in the 36 to 50 age groups, then decreases in older age groups. Internal punctum diameter shows a gradual narrowing from age 21 to 65, followed by a slight widening in the 66 to 80 age groups. And vertical canalicular depth is highest in younger adults in 21 to 35 age group, with a notable decrease in the 66 to 80 age groups. Males generally present higher values in all punctal parameters compared to females, and decrease in some punctal parameters in the postmenopausal age group may suggest the effect of hormonal changes on punctal parameters. And the presence of fluid within the punctum decreases from 90% in the age group 21 to 35 5 years to 40% in 66 to 80 years. And presence of implant was noted in 11 patients out of 128 eyes examined. Coming to the role of AIOS for in vivo evaluation of lacrimal punctal structures in our study, study showed that AIOS effectively captures detailed morphological characteristics of the lacrimal punctum, revealing significant age-related changes in punctal parameters. The result supports earlier finding that AIOS is an effective tool for in vivo evaluation of ocular structures, expanding its application in ophthalmology. Its non-invasive nature enhances our understanding of lacrimal system anatomy across different demographics. Coming to the conclusion, AIOS can be useful to gain a better anatomical understanding of the lacrimal punctal anatomy in vivo, and age and gender-related correlations were found in the punctal quantitative parameters. Thank you.
Thank you, Dr. Hasan. It was a wonderful presentation.
Thank you.
I was wondering that what is the reproducibility of the OCT in doing the measurements of a lacrimal system, which is in micrometers, because a lot depends on how much pull you are giving to the lid.
Yes,
right? So when you are doing OCT, you are pulling the lid. So we all know that it's a very minute, structure,
Yes,
and obviously the anatomy will get distorted.
Yes, that's why we should not
So I
retract
think
too
that
much.
thing should be highlighted, because
Yes.
personally I feel that we cannot say that okay, the reliability is very good of the technique.
But
that is
in
one of the limitations,
Yes, ma'am. In previous studies, almost what I did, ma'am, almost it was similar. So we can say.
But did you also correlate this with symptoms of the patient, or maybe that's the next phase?
Ma'am, I did in normal individuals, ma'am, like according to age group. In healthy individuals, I did, ma'am.
So what would be the use of your study going
Ma'am,
forward? What would you like to
Yeah,
do?
ma'am, like if you want, if some patients present with dry eye, something, if you want to put punctal plugs, so we can give accurate measurement of that punctal plug based on that AIOS measurement.
Yeah,
So
we
that,
can also correlate the
yes,
epiphora and
yes, ma'am, yes,
yeah.
ma'am.
Okay. Thank you, doctor. We'll now call the next doctor.